Okay, so we're going to do a piggyback for our patient. And first we want to verify our patient's 6 rights. So we want to make sure we have the right patient, right medication, right time, right dose, right route, and of course right documentation. We want to practice good hand hygiene, so we'd wash our hands. We want to make sure that we have proper body mechanics throughout the whole thing, raising the bed if need be, or table if need be, putting our IV solution on a pole, which I do not have because I'm doing this at home, and that way we have it at a proper mechanics so we're comfortable and we're not straining our backs or hunching over or twisting in any way. We want to check our MAR and our orders, and our doctor has ordered us to administrate Clarafron 560 milligrams IV piggyback every 8 hours, and checking the patient's allergies, which she or he is allergic to penicillin and latex. So we wouldn't so we wouldn't actually want to administrate this medication as it is counterindicated, and it is a warning that any hypersensitivity to penicillin, you wouldn't want to administrate this medication. So you would want to call the provider and clarify this order with the provider, making sure this is what he wants or if he's wanting to order something different. So we're assuming this is going to be what he wants. Checking it with our patient's age and weight, and this milligram is a good milligram for our patient's weight, which is 158 for an adult patient. We will go ahead and then pull out 5 milligrams. We want to convert our milligrams into milliliters before pulling this out. And we're going to pull out 2. I'm going to put air into it first. 2 milliliters. I want to make sure, get that air bubble out. Okay. I'm going to go ahead and just put this here and recrap it just for a second. All right. And we're going to check the order says to put it in 50 milliliters of normal saline. So I have my normal saline. I want to check my packaging to make sure there's no precipitation or anything in here. I want to check the expiration date, which ours is July of 2018, so we're still okay. We want to make sure there's no discoloring in our medication. Ooh. We're going to open this up. I just have my garbage here, so I'm just going to put it here. And we're going to make sure that we label this saying what medication we put on there, the patient's name. Sorry, my dog's hitting my IV stuff. Oh, Molly, sorry. The patient's name, his room, his date of birth, what we've put into this saline, so the antibiotics that we're putting into it, our initials, and date it. We want to put what time we administered it, and when it should be completed. And we want to put this on the back of our solution bag. But we're going to put in our medication first, and then we'll put that on. So we'll go ahead and I'm just going to wipe this down to make sure that it's clean. Go ahead and put our needle in here and just administer our medication in. And we can go ahead and throw this in our sharps container. Since I don't have a sharps container here at my house, I'm just going to recap it and put it over here. And then we'll go ahead and label it. Now that our medication is in there. All right. And so we're going to, this is going to be our Piggy Back. So I do have a Piggy Back hose for this, or secondary medication line. All right. And so we're going to go ahead and we're going to add that to our tubing. We'll just pull that off right there. And put that in there. All right, so we're going to go ahead and prime. Oh, I didn't clamp it. So we want to make sure that it's clamped. Prime our tubing. And I'm just going to set this here for the sake of the video. I'm going to put my thing on here. So we're going to go ahead and prime this tubing. And of course, you want to make sure that your tubing is clamped before spiking it into your bag so that it doesn't start to prime it already, which mine did. And then we want to go ahead and we'll squeeze this and fill our cylinder about half full. Okay, and we'll go ahead and finish priming it now. Okay. All right. And then with a Piggy Back, we want to make sure that this one is higher than our normal saline here that we already had running. So we're going to go ahead and put it on one of these and see if this will stay. So we're going to just tie it. Sorry, I don't have an IV pull. There. So we want to make sure that the antibiotics is hanging higher than our normal saline that we already had running. And we would go ahead and take a alcohol swab. And we would clean off the little connector part right here, and we would attach it onto the main tubing right there. Okay, and then we'd want to make sure that our IV solution was hanging at the right rate, and so again we would want to check that we have the right medication before check the medication against the MAR, and then check the patient's that we have the right patient, the right medication, the right dose, the right time, and the right route. And we would check it again at bedside and making sure, again, that everything is right against the MAR and everything. We want to make sure that we have our solution going at the right rate, which we want 67 mils per hour, which equals 11 drops per minute. So I would time it out for about 3 drops per quarter of a minute. And I would do that by using my roller clamp and just watching the drops and getting 3 drops for a quarter of a minute. I'm going to let that run. And we want to make sure that our tubing is completely unclamped elsewhere, otherwise it won't run. And so we have our drops going, and again I would adjust it with the roller on the tubing that is on our main bag, our main tubing. And I'd want to make sure that we document all of this, making sure that I document the medication that I was giving, the time that I started, writing that on my sticker on my bag, and the time that it should be completed.